Imagine if you could easily find solutions to make your region or city smarter, greener, better connected, more social, and closer to citizens. The Interreg Europe Policy Learning Platform can help you access knowledge about the latest policy trends, discover expert-validated good practices from all over Europe, find solutions in our peer review, get tailored support from our expert team. We can connect you with the right people and organizations. Together, we will find ways to solve your region's or city's challenges. Start your policy learning journey today.
Good morning, everybody. Welcome to our Inter-Europe Policy Learning Platform webinar. My name is Mart Veliste. I will be the moderator today. And together with me is my colleague, Schmerber, who is the co-moderator. So today we're going to be looking at supporting health tech innovation and SMEs under the Smart pillar of the program. And together with us is also our colleague, Lotte, who is our technical support. So she is in the meeting under the name Policy Learning Platform. So should you have any technical issues, you can write to her directly in the chat. In general, we are using the chat as well as the Q&A tool for asking questions. So if you, during the presentations that will come, you have any questions to the speakers, please don't hesitate to write them out there. And then we, as moderators, will pick up the questions from there and read them out to the speakers. And also in the chat, our colleague Lotte will be sharing some useful links and extra materials as well. And of course, you can use it to also connect with each other throughout the webinar. So today's agenda is structured around 3 presentations and then a general discussion with the speakers. We have Kathleen D'Hondt from the Flemish government, who will give us a broader ecosystem view of how for several decades now they have been developing and supporting both the research as well as the commercialization side of health tech. So this is a sort of a big narrative example of that. And then we are featuring 2 Inter-Europe good practices, one coming from the Notte project that would be presented by Irene Murillo Garcia from the San Sebastian Socioeconomic Development Center. And this is about a voucher scheme that is focusing also on health tech innovation. And then we have, last but not least, Alizée Joseph Rose from Cluster NSL, who's going to talk about the HIPＡA project, which is a type of a test room for products for the elderly. And as said, we're going to wrap up with some questions and discussion. And after each presentation, you will also have a chance to ask questions. But before we start with the content, still a few words about the policy learning platform as such as well, because there might be audience members who don't know who we are. So we're part of Interreg Europe. Interreg Europe finances hundreds of projects intended to improve the policymaking across Europe, across different sectors and fields. And in order to avoid the work done in the projects, sticking in only within these projects or would remain in those silos, the policy learning platform is there to valorize the rich knowledge and to then organize events, workshops, webinars, to write policy briefs and stories and articles and so on, to ensure that the knowledge gets to a broader audience and that we can also all learn from each other. And one of the things that's maybe more unique about what the platform does is our expert services. So these are expert services that are available for all public authorities across Europe, free of charge. And they are meant to assist you in tackling specific policy making questions you might have. So the idea is that we bring experts to your region, or we meet online, and together with these experts, peers from other regions of Europe, we discuss the challenge you have, and we suggest solutions, because often the policy challenges that one region have are not that dissimilar from other regions. And in some cases, somebody's already done something very promising or innovative in terms of policy intervention to solve that challenge. And the goal is to share the best practices as well as failures. And the difference between a peer review and a matchmaking is the length. So the peer review is a physical event, normally lasts for around 1.5 days. And the matchmaking is a virtual, mostly a virtual meeting, taking around 2 hours. But whenever we organize physical workshops, you might have also seen that on the second day of the workshop, you can also apply for a matchmaking. And we've been doing this since 2019, and the map is populated with these different pins, but there are also empty parts on the map as well. And if you are from one of those regions, don't hesitate to consider and then look more into these services. And there are also just 2 examples. So regarding the health focus that we have today, then in 2021, there was a peer review organized for the benefit of Hungary to talk how to diversify the sector. And there we had experts from Austria, Italy, Spain, and Sweden giving their advice to the Hungarian colleagues. And when we talk about just SME support, which is also the topic of today, then here's an example of how in Poland, there was a question of how to set up a voucher scheme. Today also you will hear Irene talking about the voucher scheme, but then this was sort of an on-site hands-on discussion on how a voucher scheme could be set up in Poland. And as an example for matchmaking, completely different topic, but just shows you that these sort of governance topics are also very welcome for matchmakings and peer reviews. And lastly, we have this large team behind us, and depending on the thematic area you're working on, you might either collaborate with me and my colleague Luke, or you might meet our other thematic experts. So almost all policy challenges across all fields are welcome. So whether it's education, whether it's sustainability or innovation, then all of these are eligible for our support. But today, then, we are looking at the health tech innovation and health tech SME support. And within the Interreg Europe projects ecosystem, we have several projects currently working on health. So as mentioned, we're going to have today a speaker from Notre project that's looking at senior care related solutions, but there are other projects also tackling other subtopics. And in the previous programming period, we also had 4 projects working on health tech SMEs and health tech innovation. I hope that some of them are also in the audience today. Still remember their good time with working on these projects. And overall, part of the discussion today is likely also relevant beyond health. So that's why I'm also mentioning here that we have around 18 projects currently working on SME support in general. And the reason why we sort of decided to set up a webinar on this topic is because, I think we all know the context. Europe is aging. The predictions are quite drastic, and therefore new challenges for our societies emerge. Also, how to keep the population healthy for a longer time, how to sort of maintain their quality of life, and if their life expectancy increases. So there is plenty to sort of discuss and solve from the social side. But as we are organizing this webinar today from the Smarter Europe perspective, we are also looking at the opportunities it gives, the market opportunities, the business cases. And here, Europe does have a chance to be a global leader for already several years. It's been one of the fastest growing industries globally, but also in Europe. And it can have quite a large GDP share in different economies across Europe as well. So that's the context for today, and we can basically start with the speakers. But let me double check now with my colleague Lotte if our first speaker has arrived, or we still need to.
Hi, Marty. I'm still trying to get her on board, so
Okay.
it might still take a moment. So maybe we jump to Irene first.
Yep, that's perfect. So basically, we are having a bit of technical troubles with one of the speakers, but then Irene, you are ready to go. So please tell us a bit about the voucher scheme you're implementing in San Sebastian.
Yes. Okay. So first of all, thank you very much to the organization for inviting us. Can you see my screen? Yes. So Okay, so we Fomento are part of Notre project, and also who we are. So we are the Economic Development and Innovation Agency of the Municipality of San Sebastian. It is a medium-sized city in the north of Spain. So our activity is based on 7 strategic lines. I'm just going to mention 2 because the technology vouchers program is inside these 2 strategic lines. So they are the Innovative Entrepreneurship Hub and to be a science city and innovation platform. So the technology voucher program in collaboration with Biogipuzkoa. Biogipuzkoa is the health research institute of the city and carries out its activity with the aim of promoting biomedical, epidemiological, public health, and public health services research. So why did we develop this program? Which is the objective? So we wanted to connect small SMEs, startups, and entrepreneurs with Donostia and other technology centers. But in this case, Biogipuzkoa, sorry, they've changed the name 2 months ago. And so why? Because Biogipuzkoa needed to transfer the technological capabilities and advanced services to the business, local business. And also local businesses need this technology to improve their projects, products and services, and to be more competitive. So at that moment, these both actors were very distant because of they didn't know each other. Because for SMEs and startups, these kind of advanced services costs a lot of money, and what we wanted was to solve this problem and to connect both actors. So main features of the program, as we have said, the target group are startups, SMEs, and innovative entrepreneurs based in San Sebastian. Sectors in this case, so innovative business projects of the health sector and specifically in the hospital sector. The type of services for this technology voucher program with Biogipuzkoa is what Biogipuzkoa offers. Let's say their advanced services and their technologies. And for example, advanced services regarding laboratory in the field of health biotechnology or innovation support services or biohealth research focused on patients. In this case, with Biogipuzkoa, we offer two kind of voucher. One is of 2,000 euros, and it is free for the company, and it is co-financed by Fomento and by Biogipuzkoa. And then we have the second kind of type of voucher, and it is of about of maximum 12,500 euros. And if in this case, the startups, SME or entrepreneur has to co-finance the 10% of the value of the voucher. Yeah. How does it work? We do it by 1 open call per year. First of all, what we do is to evaluate the innovative projects in which this technology is going to be developed, because for us, for Fomento, it is very important to support innovative projects. That is a key for us. And then there is another evaluation of Biogipuzkoa. And this evaluation is done, it is based on different criteria. And that's it, the justification of the services, the probability of achieving the expected results, and the degree of technological absorption of the company. This is the equipment, the team, previous experience, and etc. Once the voucher is approved, then they have 6 months to develop the service. Yeah. And then what we do is a final justification of this this work, and it is we need to see the invoice, the payment of the corresponding part of the companies in case of this 10%, or the VAT that it is compulsory in any case in any type of voucher, and a final report. Very briefly, we launched this program with Biogipuzkoa in 2016. Since then, we have developed or approved 32 projects with an amount of almost 360,000 euros. Here you are 2 examples. Perhaps a little bit later we can talk about them. This is something that I wanted to explain you, and because I think it's important. So the technology voucher program in collaboration with Biogipuzkoa, it is part of a bigger program with other 6 technology centers of the city. For us, this is very important because the idea is to be not only support on one specific sector of projects with one specific center of technology centers, and to be able or to facilitate to city innovative projects, to be able to get different technologies. I mean, for example, an innovative project in the health sector will need, of course, technology of a technology center of health sector, but also from other sectors. For example, perhaps this project will need bio-nanotechnology or eye tracking or cyber security in case of data of patients and wherever. So in our case, it doesn't matter if the innovative project is from health sector, but we give them the opportunity to get different technologies. So this big program as a whole was launched in 2014 with just one technology center, and since then we have approved 335 vouchers with almost 4 million euros. Here you are some recommendations or things to consider when launching it. For us, we think that it is very important that the technology centers must have the need to transfer the technology, because this means that they are going to assume part of the cost. So the commitment of this tech transfer in the city, in the regions, will be from both sides, so like win to win. And yes, the second one will be also that it is important, perhaps not at the beginning, but that SMEs or startups also assume part of this co-financing or the cost of the technology voucher, because this means that they don't do because they have the grant, but yes, because they need it and because they are able to continue with this development. So of course, first of all, let's start with a pilot test with a few technology centers to prove it. Also set a certain number of vouchers per year in order to control the budget. What I have said, it is important not to do it sector by sector. it is very interesting to do it, like so to be able to have a mix there and to take advantage of all technologies you have in your regions or in the city, and also to organize information sessions for companies and SMEs or startups, so that they know these technology centers, who they are, what they do, in which conditions, and this is very important, and it is the last recommendation, how they tackle with or manage their IP of this tech transfer. In our case, what we decided, as they are 7 technology centers, and each one has their own IP model, we leave them to manage like that. So we are not decide which has to be the IP management for each city center. And what we do in this sense is to be to assure that the technology center and the company have clear which is going to be the IP model from the very beginning of the before starting the service. And I think that is all.
Yeah, super. Thank you, Irene, and especially the last slide. A lot of rich knowledge to anybody who wants to set up voucher schemes. I think it's a super valuable insight. So while we're still waiting for the audience to also write in their questions, then Luke and I we can start. So maybe I was curious that you mentioned that this is part of the system where you have 7 technology centers. Was there some sort of a selection behind it as well, that these follow the Smart Specialization Strategy of the region or some other policy document? Or was it just that, okay, we have the competence in these research centers, we are going to provide the voucher schemes to all of them?
But it is true that we are lucky, or I don't know if it's something of luck or of years and years of collaboration. But we are very next to the technology centers in the city. So we also collaborate in different issues, not only tech transfer, but also in issues related to talent, to science dissemination, to other strategies together for the city. And so in our case, it was quite easy in that sense. It is quite easy in that sense. So we are open to new technology centers. It is not something that we have chosen in that sense. What we do is always an agreement and collaboration agreement for that, non-economic, because that then we assume from both parts this cost. And yes, there is not any selection, let's say that like that.
Thank you. And then maybe my colleague Luke can take the next.
Yes, thank you, Mark. We don't have questions yet in the chat, so I would again encourage the audience to submit them. But as we were discussing about the technology centers, Irene, I would like to come back shortly to that, because your first recommendation was about the fact that the technology center must have the need to transfer the technology, and I wanted to ask if you can elaborate about this. Does it mean that there is part of their duties to transfer, or what does the need from? Is it some kind of obligation, or is it something different? What you mean?
Okay, I don't know in other countries or cities, but in San Sebastian, or the kind of technology centers, we have some of them. They have this obligation in their internal, let's say, the word it's not rules, but so the among their objectives of the center are to do this technology transfer to the businesses. And here really we had a problem because they didn't know each other. So there was a huge distance between acknowledgement, let's say that, and businesses. But ones really needed to approach the others because not only to reach the market as itself, but also because it was an objective of the centers, and that's it.
Okay. So there is some kind of rules or objective. The budget depends then in some way also on the
indicators,
way
and yeah, that's it. And also it is very interesting for them because at the end this is an economic tool or a tool to approach businesses and startups because they can say, okay, this will be free or almost free for you, and let's know each other. Let's prove if we can work together. So it is a good tool for them.
Are you helping this process too? You mentioned that you organize information session. Is your organization involved in this connection process?
Yes, we are the ones which organize the sessions.
Yeah. Okay.
Yes, because the program is, let's say, from Fomento.
Yeah.
Okay. And I also noticed that one of the recommendations you had was still rather try to find maybe more mature SMEs or startups, so that there would be potential that it won't be just this one voucher and then the money is spent, but there is potential to sort of continue the collaboration and I think you had also two examples of some nice results. So maybe you can a bit elaborate on especially in this health sphere, because that's often also very, let's say, a very, I guess, resource intensive, expensive sector, and the voucher can only just go so far. So I wonder if you have some nice example how this collaboration was started thanks to the voucher, but then it was developed further.
Yes, that was the idea. At the beginning, we didn't, all our vouchers were free for the company, but then we realized that some of them it was okay also, and it is okay, but used the technology vouchers for let's prove and let's see what happens. And no, okay, that is necessary to do that. Let's test if it is like this, or if we have to change the route. But what we needed was there because everybody knows that these projects are very, very, they need almost 10, some of them 10 years to reach the market. So they need a lot of financing, they need a lot of technology development, a lot of proof of concepts and whatever. And so this was interesting, and this was necessary to support projects that could continue and could develop and could survive.
Mart, we have some questions now also from the audience, so maybe we can just give them to Irene if you have some time. The first question is about where does the money for the vouchers come from? Who is paying for that?
Yeah, from our side is directly from Fomento's budget. And I don't know, from the technology centers, each one manage their own budget. So I don't know if some of them had money from another institution, or if it is from themselves. In our case, this program comes directly from
the Economic Development Organization.
Yes, yes, from our budget.
Another question directly related to the implementation of the voucher. Joanna mentioned that 6 months doesn't sound like a lot of time. If you experienced if the time was enough to implement the project, or if it's difficult. what is the experience?
We are very flexible in that sense because it is true. Sometimes it is enough, much more than enough. But sometimes it is a very short time. What we do is the SMEs, or the startup asks us for more time, and we give them. So
Okay.
it is not a problem.
Yeah,
But I think that
Yes, but it
flexibility
is
often is needed, right, as well, because
yes, but it is also it is necessary also to put a time, because if not, it could be a very, very long process. So we have 6 months, and then we have the flexibility.
But then I will thank you, Irene, for now. We will see you later on the screen again when we have a little group discussion at the end.
Okay.
And thank you also, Luke, and thank you to the audience for the questions. We will now
Thank you.
try to connect with our speaker, Kathleen, but we're testing a technical workaround to the issue, so let's see if it works. So please, Lotte, let's see if we can make it
Yes,
work.
thank you, Mart. I have Kathleen here with me, so let's give it a try. Kathleen, maybe you can introduce yourself and see if this works.
Thank you. So, do you hear me loud and
Yep.
clear?
Yes.
Okay. So first of all, my apologies for this. It's totally unexpected. At the moment, you don't wish that it happens. So I work for the Flemish government in Belgium. So we have in regional competencies on research innovation. And so this is not at the national level, so that is why we are involved here. So next slide, please. So Flanders is very...
Sorry for a moment. We cannot see the slides, so maybe I share them instead, because I think, yeah, when you go full screen, they somehow disappear. So I will share them for you. Let's try it that way. But we hear you very well, but just the slides are not. Yeah. So I hope you can see them as well. I'm on the second slide now, and you can continue.
So we are very densely populated, with almost 60% of the population on less than half of the surface in Belgium. The most important message on the slide here is the research intensity. That is the global expenditure on R&D expressed as a percentage of the global domestic product. And this is already for some years now over 3.5%. 2/3 of this is contributed actually by the industry. So that made us also to accelerate very much in innovation and got to the level of innovation leader in the regional innovation scoreboard. So also internationally, we are scoring very well as the 3rd best innovative system in the world. Of course, we are very proud of these things. So next slide, please. And this ecosystem around health is built around the 5 academic centers in Belgium. So this is a very full picture, but it's the University of Ghent, Leuven, Antwerp, Hasselt, and Brussels. So, and connected to that, we are supporting what we call strategic research centers, which have an emphasis on nanotech, that is IMEC, the other one on biotech and life sciences, the VIB. VITO is on technology research. And together with those, with the strategic research centers, we also support the creation of biocenters and bioincubators and bioaccelerators to host startups and innovative companies. And these companies are also represented in the member organizations, cluster organizations like Flanders Bio, and a spearhead cluster, which gives support to the biomedical industry. So I will come back on all the different steps here, on the different organizations later in the presentation. We also give a lot of support to the European research infrastructure, like Alizée, that gathers life science data, and BBMRI, that is the infrastructure that provides access to biomolecules and so on. And in this whole process of going from academic basic research to the translation into innovation, this is supported by a whole panoply of funding manners. So they are listed here on the bottom of this picture. We try to have funding for each step in the value chain. And then the next slide, please. I will focus a little bit more on the different players in the field, what I just mentioned on this overview slide. So since 1984, there was a large support from the Flemish government to build a center of excellence in semiconductor technology, micro and nanoelectronics. And the idea was that they should be ahead of the current technology development. So right now, they employ over 5,500 people, with over 3.5 billion euro invested in the semiconductor. But more recently, there's also this focus on the acceleration of convergence of technologies, also in the health field. And so the revenue now increased in 2023, so these numbers are from last year, are almost 1 billion euro. In the VIB then, that's the other strategic research center, the Flemish Institute for Biotechnology, that was founded in 1995. And the funding, the core funding, this is next slide, please. And the core funding is provided from the Flemish government, and this amount almost in this year to almost 86 million euro. And that gives us an output of over 700 publications a year. They are a lot of success in gathering the ERC grant or the Marie Curie grants, but also so this the VIB has a threefold assignment, and that is being excellent in basic research, translate this research and have a successful tech transfer policy, and also communicate to the broad public. So the tech transfer resulted in almost 800 patent applications in 283 active patent families. And because of that, and there's also this is translated in startups and licenses agreements. So the income of the industry is now almost 28 million euro, with 272 partner agreements last year. And they also attract international biotech companies to Flanders. So, and as for the startups, since the founding of the VIB, there are 37 startups, which equals a capital investment of 1.8 billion euro and over 1,000 employees. They also established their own life science investment fund to support, as I said, also the different steps in the value chain. And they are also supported by those bioincubators where startups and innovative companies can find their way. It's now a surface of over 25,000 square meter. So this is quite extensive. So the next slide, please. The VIB is focusing on 8 research areas in 10 research centers. So the focal areas is immunity and inflammation, cancer research, the medical biotech, neuroscience, but also plant biology, microbiology, structural biology, and computational biology. And next to the high-end research infrastructure, they also supply access to the most novel technologies in so-called core technology facilities. So there are 14 of those focusing on providing access to the high-end bioimaging infrastructure, data infrastructure, flow cytometry and related technologies, and then to all the different omics technologies. And they have a dedicated group that watches out for those technology developments and new trends, and to provide as soon as possible access to these. And this is a Tech Watch team. And then the tech transfer is led by different core. They make sure that the IP is well protected, and it has twofold outcome. This is in agreements with the bigger companies, or to create new startups. And you see the logos listed here. And together with to give the room for the startups and the developing biotech industry, very soon they established also, the next slide please. They also established a cluster organization, Flanders Bio. And so they ensure that there's a good communication between the different industry players, the big companies, together with the smaller companies. So you have actually in Flanders this very unique ecosystem where you have in 1 hour drive, you get to the big pharma companies, but you also find the startups and smaller innovation companies well represented. So that is part of why it became so successful over the years. So the next slide, please. And more recently, 3 years ago, there was we started to invest in what we call the Spearhead Cluster. It's an innovation cluster that focuses on to invest in innovation in health and healthcare, in digital technologies, medical technologies, and medical biotechnologies. So right now they gather 150 members. And they are strongly investing in innovation projects with the members. So the next slide. And to be sure that we embed this Flemish ecosystem internationally, interregionally, we also invest in a lot in the trends that are ongoing in Europe. So we are active partners from the government side in the development of the European partnerships. So the one on personalized medicine, on brain health, on AMR, One Health AMR, and Be Ready is on pandemic preparedness. We are also active in to drive the regional potential forward. Do you still see me, hear me? Yes, okay.
Yeah, we still hear you, yeah.
Yeah, okay. So we are also investing in the Smart Specialisation Strategy. And a couple of years ago, we started this CSA from the Commission to focus on the role of the regions in developing and accelerating the development of personalized medicine. And together with that, we started the Smart Health pilot, the Vanguard initiative, under the Vanguard initiative on smart health. We are also focusing on the so active partners in the 1 Million Genomes project, and invest in Alizée, so one of the main infrastructures to share life science data to develop further. And so coming to the Vanguard initiative, so we gather now, I think it's 13 or 14 regions, they are listed here, and together with EIT Health, that's how we try to build further in the regional network in an interregional setting. So, and if on the next slide, you see the focus of the Smart Health pilot, where the accents are laying to develop new projects. And this is, of course, data and digitalization of biology and health, basing ourselves also on the convergence of technology. And that is not only data, but nanotech, biotech, and the cell technology developments. We also try to go in direction of innovation in healthcare with supporting preventive health and patient empowerment, and primary care is their accent domains. And of course, then the final pillar is to ensure the sustainability of the healthcare system, focusing on regulatory aspects and implementation together with skills and education are important messages here. So, and this is where I would like to end, because the Smart Health pilot is where it all can build further. So I'm happy to take any questions. Thank you.
Thank you, Kathleen. Maybe I'll ask the first question about the Vanguard initiative. I think on the slide it was also mentioned that it's open to new regions. So what does one need to do, or which characteristics do they need to have for that their region could join also the initiative?
Well, we think it is important to focus the summary slide on the 4 pillars and the accents. We do have a document that we can share more in detail what it's about. And then what we generally ask is that the interested region puts forward their own assets, where they can contribute in this scheme, and where they are looking for the complementary assets from other regions. So it is up to the interested parties then in the different regions to identify, and I think this is the most difficult thing. People know where they are, but the most difficult thing is to identify where you want to be in 3 years, in 5 years, 10 years, and what is it from complementary assets that you can ask from the other regions. But it's open to all interested parties, also just to share ideas on the first ground.
Thank you. Luc, I give also word to you.
Yeah, thank you, Mart. So again, I would encourage everybody that's to submit the question through the chat or through the Q&A feature of Zoom. We have none right now, Kathleen, so I will go on also a bit from my side. You were presenting the ecosystem, which is very interesting. I wanted to ask how you deal, or if you deal also with the investment access aspects in the companies or developments, because the health sector is one of the sectors the investments, especially in those deep tech projects, are high. If you also have those actors in your ecosystem besides the technology actors.
So I didn't get the question very well.
If you have venture capital and active in your ecosystem, and or public funding organizations which are directly investing in the companies, in equity and financing the project, also if those actors, the investors, are also part of your ecosystem.
Well, mainly private partners, of course. But the different strategic research organizations, they put up their own venture funds, and they can invest in the projects, of course, where the needs are. From government side, it's a mix. So there is we do have a lot of regional funding for startups and innovative companies. It's not. It's an agency, the FLYO, the Flemish entrepreneurial organization agency, is under our policy domain, but we ourselves are not dealing with it. But the agency does, and they have quite different schemes also for the different steps in innovation and the different types of partners. So that is a very important source for funding. Then you have the participation society, if I translate it correctly. But that is also on the slide. You can see different funding agencies or organizations that try to.
Yeah. Okay. No,
Maybe
thank you.
I have one more question from my side, and then I see that there's also an audience question. But I mean, in the last, let's say, 2 decades or more, a very impressive ecosystem has emerged in Flanders around this sector. But I'm curious to hear, what do you think, in your view, is sort of the responsibility of the public sector in supporting the health sector innovation or the SMEs? So what type of role should the public sector take regarding the health innovation in your view?
The approach we had, I think, was very successful, and that is asking for excellent basic research to be top of the world, if you like, in the domain, but also ask for good, solid tech transfer and provide the funding for the different steps and leave enough room for incubation in the different steps. So to excel in basic research is not from the first year. You have to maintain that, and you have to put your standards very high. And the tech transfer in VIB is very closely following the outcome of the research. And that took a mentality change also from the researchers, because researchers are used to be not in favor of industrial development because it inhibits your publications, and a researcher only exists by the publication. But they set up a team that is so good and active to capture the outcome as soon as possible and put it into the trajectory without inhibiting the publications. So then in the end, everyone was happy, the researchers, because they could have the publication. They also had patent applications running, sometimes awarded. And that was also for them, it's very rewarding to see what happened. And also if you can see your research translated in a startup, that is a major step forward. And that changed, but that took a long time. But it changed the mentality very much. And also the VIB is providing sufficient incubation time for a startup. For example, they incubate it first in the premises of an academic environment, then it goes to the bioincubator, and then to the bioaccelerator when they grew out of the startup phase. But it provides all the right needs in the right time for sufficient time.
Yeah, that's super impressive, because this challenge of getting researchers to collaborate with businesses is always, I think we hear it across Europe, that how do you get them to speak the same language, and the time horizons and the ambitions are different always, right? But it seems that you have found a good way through it. And look, I think we have one question still from the audience, if I'm not mistaken.
Yes, I was just making notes from what Kathleen mentioned because it really was interesting for us. Joanna asked, how do you manage to capture the different bottlenecks? You presented also the smart health, let's say, value chain, and about the sustainability, about the preventive health, about the converging technologies, about data and digitalization, how you work on identifying those the bottlenecks you need to work on in the system.
I don't know. It's like a natural evolution. So but it's true. IMEC is excelling in the technology side, on miniaturization, on the nanotech, and that is now the digital. So that makes it possible to also to innovate a lot in biology and understanding the basics of biology. So single cell technologies, all the omics technologies, data, AI. This is all the core business of IMEC. And as both IMEC and VIB are subsidized by the government, there is this this interaction. And more, the engineers and the life science scientists began to understand each other. And that is, the innovation that is ongoing in the digitalization of life sciences is immense. And data, all the data, technologies and facilities, this is just immense. And we also, from the government side, we provide the subsidy for the two research organizations, but we leave them free. We don't have a top-down approach. Everything is bottom-up. But what we do focus on is on the developments in Europe in the context of the framework program, and support there and point to where the options are. And that's, for the rest, that's what we do. The only thing that is a bit more focused is the Spearhead cluster to provide budgets for novel innovation among the main industry players. And then the Smart Specialisation Strategy, which also has this focus to go to higher TRL level projects. But we work mainly with bottom-up approaches.
That's the benefit, I guess, of having an ecosystem that works nicely, and people that interact. That you mentioned those interfaces, because so you mentioned also, I think, the convergence of technologies, and also the convergence of different expertise coming here together. Mart, do we have some time still, or what is the...
I think we can go forward. Because I also believe that Kathleen had to go to another meeting. So I think we can thank you, Kathleen. Sorry for these technical challenges, but we heard you well, and we got to share the slides also. And indeed, we can share the material regarding Vanguard initiative through the article afterwards if deemed relevant. And with this, I would then invite Alizée, our last speaker, to come and talk about on a more, again, going from the big ecosystem view to a small practical practice example regarding the HIPAA project. So please, Alizée, and the floor is yours. And of course, please introduce your colleague as well, because I forgot.
Hi, everyone. My name is Alizée Joseph Rose, and I come from France. And I'm with my colleague, Fanny Boyeral. She works with me on this project. So I will share you my presentation. So now I think you can see my screen. So HIPＡA project is it's a project aims to support older people to stay at home comfortably and independently. So HIPAA is are showrooms like apartment dedicated to well-being for elderly people living at home or in an establishment. It's open to public and occupied with the last solution and innovation linked to healthy aging, nutrition, security, well-being, and social abilities, and mobility and adaptability. HIPAA apartments are based in northern France. It can be visited individually or collectively all long year, thanks to an animator who knows all the product and solution. So on this slide, you can see our two showroom. The first one opened its door in 2018, partnering with La Vie Active, which provides services to senior and individuals with disabilities. This showroom is part of a senior living community. And the second location opened its door in Arles in 2023 in a renovated historic home. This project was made possible through a partnership with the social housing provider Maison et Cité and the home care services Vitaliance. So the concept over the years, HIPAA was initiated in 2018 with the financial backing of the Pas-de-Calais department. We've secured additional funding annually from various sources, including foundation and pension funds. Since 2021, HIPAA has expanded, introducing digital tools like a virtual tour in 2021 to explore the space from home, and the HIPAA Adapt digital platform in 2023 for information on home adaptation grants. To make things easier for seniors, we've developed the box test project in 2022. This project, which brings services directly to them. A pilot phase with the La Vie Active and 4 or 5 other partners was conducted in 2020. In 2024, we've expanded this project to 4 more regions, 3 urban regions and 1 countryside in northern France. Currently, Alizée is collaborating with Municipal Social Center to establish new demonstration spaces. So we are working with Lille, for example. About fundings, HIPAA received funding from the Pas-de-Calais department in 2024. And box test project is supported by a health insurance company, the same years, Malakoff Humanis. And about this project, I have some good practice to share with you. The first is human resources and their complementarity. Having a dedicated project team and complementarity between actors is important for welcoming the public and bringing the place to life. Making the place known to local partners. Having a dedicated team for project communication is essential to make it known on the web and at partner event. And for example, for us, we were complementary with La Vie Active and Alizée. For example, La Vie Active is the animator of the place. They made the visit, for example, and us in Alizée, Club NSL, we have an expertise on the communication and to promote the project over the France. The second point is local partnership. Building strong local partnership is essential for the success of our pilot project. It ensures that our initiative is well known and recognized by key stakeholders. Location, so urban location provide greater accessibility, of course, and a larger potential audience. The fourth point is functional equipment and comprehensive services. Visitors need to be able to test the equipment, so it's essential that it works properly. Our staff should be well trained to assist them. And the last point is being innovative and agile. And for example, for us in 2021, it was very difficult for our showroom because it was the COVID crisis, sanitary crisis. So we developed some digital tools to go on visit our space. So it was for us an agile position move on. And the common causes of project failures are poor communication, inadequate networking, and insufficient resources. Yes, so thanks for your attention.
Thank you for this comprehensive overview. I also invite my colleague Luke back on this stage. How do you select the companies that can showcase their products either in the showroom or in the test boxes?
Good question. We were looking for companies which were in contact with the public, because in Santé we are not in contact with the public. And we found some services association which wanted to work with us, so it was okay.
And can you tell a bit more about this test box? So how many devices does an elderly, I understand it's a box full of devices that's sent to an elderly person, and then they can test the things for a period of time. So maybe you can, it seems very innovative. I haven't heard of something like this before. So maybe you can talk about it a bit.
Yes. Yes, there is several actually innovation in the box, could be from different tools or things like that, from like security device like telesurveillance or things like that, to like kitchen tools for easily cap opener or this kind of can opener or this kind of thing. So it's really wide range of innovation that you can find, and mostly from 5 to 10 innovation. Actually, people can select which one are the best at the end, and they can buy the tools actually at the end of the process. So they keep the box at home for maybe a month or something like that, and at the end they decide which tools they want to keep. And depending on also on the price of the tool, we have also services that can help them to find like grant or money from local region or municipality for buying some tool, because you can imagine that some security tools can actually cost a lot, like watches, that can find if the person fall or not for security is actually have a certain cost compared to some kitchen tools. So that's why we provide, and our local partner is bringing the box directly to the person at home and bring it back also to our showroom space at the end.
It seems like the tools or the things that are presented are final products that can be directly used and bought. I wanted to ask, are you also involved in some project development phase, sometimes working with research or with development of projects where you have, let's say, prototypes or something similar?
Actually, not in this specific HIPＡA project and in this box test. We have other projects where we are helping experimenting new innovation on with elderly home and other things, but this is not a part of our job. In the HIPAA project and the apartment and the box test, there are already developed projects that can be used directly, that are already commercialized.
sorry. So the purpose is not so much about validating the product or the need, but it's more about showcasing what you can purchase as a elderly care home or as an individual.
Yeah, it's to bring innovation that will not be thought of, I would say, directly to the person. So it helps the person to think, oh, I actually need that, or this is really helpful for me. And most of the person or even elderly house will not actually have this showcase, will not have this access to this direct innovation. And as we are working with the whole ecosystem, we can find easily things like that and provide it to them. So yes.
Mart, we have a question from the audience. The first one coming in. If there, maybe not in this project, but in a similar project, if you have already been working with let's say socially assistive robots in those smart homes, if there have been robot.
That's a good question. We are not. We didn't have this type of innovation. Yes, it will be quite interesting to test it actually. But I'm also a bit worried about the age gap of person that can understand this type of advanced innovation like robotic and such. For elderly population that we speak of, like more, I would say 70s and higher. But it will be interesting to look.
I think it's possible in maybe in establishment because the cost is high for at home for all the people. It's maybe a little
too much,
too much expensive.
And I think they will need also guidance and assistance with this.
Yes.
Yeah, so you need the environment, you need the equipment, the staff, and so on to operate like this. But okay. Yeah.
I think please go ahead.
No. But I'm also curious because Alizée presented that you also did something virtual during the COVID years. So for me, showroom is very physical. I come and touch and feel and experience. So how did you transform it into a virtual setting?
So basically we have a website where you can directly access like a virtual visit of the house. It's like sometimes you see when you visit a house that you want to buy, you can actually go from room to room, and there you can actually click on things and to open the doors and things and to see innovations. All the time you have points you can click and you can directly see which tools you are looking at. Like, for example, we have a seat to help people going up easier. So they can click on this seat and they can see the small windows pop up with all the explanation that's written. And if they are interested, they can actually click on it and see, I want to see more, I want to be connected to someone to know about this innovation. So it's basically, just a virtual housing tour and with all the innovation dispatch. And we worked with a designer
all the explanation.
With designer to provide these services online. So it was actually a really interesting project to do during COVID when everyone was staying home.
That's very impressive. And maybe last detailed question, are you only showcasing French products and services, or are you open to also, because we have in the audience, we have different regions, they're also maybe working with their local, let's say, health tech companies, maybe somebody also has a nice innovation ready to go to market. Are you open to showcasing them as well, or is there like a regional focus?
No, we are open to all type of innovation and all international innovation, of course, if it can be explained easily in French to elderly person that might only speak French. But for us, it's not an issue. We just want the best for the community. So that's what we want.
Thank you. And with this, I would still then invite also back Irene.
Mart,
so that we can...
if you allow, there's a question coming in for
of course, please.
Just then we can move. Because also you mentioned this aspect of working with the elderly and so on. And the question is about the digital divide and the test box, if there is some need to do some trainings for the person, so to use the tools or how you deal with those aspects.
Yeah, it's actually a good question. So the partners that are directly going to give the box of innovation to the older people actually can provide explanation on specific products if the person needs it. So they are trained to provide explanation, but it's a really simple device anyway. Like if you speak about small clocks that will, or small watches, something like that. So it's a device that can be easily explained to elderly people. But yes, the person that going to their home can train them directly.
So the box is brought by a person, and there is some kind of introduction to the box and so on. And so
exactly, yeah.
Thank you. Sorry, Mart, for jumping in. The question
okay.
just appeared.
So yeah, while also I'm asking Irene to come back on stage with the camera and join this, but I'll still start with one more question actually to Alizée and because you've been working on these showrooms and the test boxes quite many years. Has there been one product that has really surprised you? Like, wow, like I need this. My grandmother needs this. Or I mean, you mentioned these security watches and devices, but has there been something that really you think is like, considering the trend we have in Europe that the society is aging, is there been something that has really inspired you?
So actually, we were surprised about the need for kitchen tools that can be easily handled by elderly people. So everything from the can opener to the salad water remover, something like that, is really high demand, and it's also the price is really accessible. So when we think about that, there's some things that you use all day, every day at home, but it's difficult to handle sometimes for people. Also, when you think about aging, you also think about some health issues, some hands again easily difficult to work on, things like that. So these tools that are needed every day is really interesting for them to use. Yeah, that was the main that's the main interest actually in our textbooks. Yeah.
And this, I think, is an important component to our discussion today in general, that, okay, we talk about health tech and we talked about this, big ecosystem and a lot of research, what Kathleen was talking about. But then you also have the other end, which is the silver economy, the simple products that actually people need, which is a completely different type of, let's say, innovation. And I think maybe then I'm curious from San Sebastian, when you also, I think, Irene, you were talking about this importance of not just health company using a voucher with the technology center around health, but also having these cross-sectoral potentials to collaboration. So maybe a similar question, Irene, to you, that as something surprised you when working with these different vouchers and the companies, that this type of innovation that is being developed in your region? Irene, can you hear us? So you are muted and we cannot see your camera.
Okay, sorry, I was thinking that the question was to the other colleagues.
No, it was for you. So
Sorry
basically,
about
it's a similar question that as something regarding, let's say, the innovation you see in the companies using the vouchers has surprised you that, oh yes, this actually is very in demand, or you see that this has potential?
Regarding the companies at itself, not the city center. Yes, yes, we have some interesting examples and some scalable examples regarding the for example, in this for elderly people or in this health sector. So things related to it is like kind of system, automatic system regarding that people could live a life at home, alone at home, and this it is developed with sensors, like it's able to know if the person is okay, if the person is feeling sick, if the person falling down and whatever, and directly to call to the to the ambulance or to the hospital or wherever. So we have some interesting projects that could be also scalable and used in different kind of living spaces or residencies or even in hospitals. Yeah, this is just one example.
Thank you. And
I think, Mart, sorry, that was just to jump on this idea of the scalability and the economic development, which is the purpose of Fomento and the vouchers. Maybe getting back to our French speakers, if they also know in the project about how it helps to the companies to develop that sells those products, if they have some feedback from the companies, if it contributes to their economic development and to the growth of the companies themselves or not.
Actually, we don't know about these economic values. We're working more about the visibility of the companies than to ask about the economic aspect behind it. So that's what we provide, is more visibility to a community that might not have accessed before. And we don't have yet the bigger picture behind with with specific numbers.
Okay. So. Then my second question, and I start, Irene, with you again. In your experience, what type of support is most needed by the health sector companies? And is this support any way different from all the other sectors? Because you have this sort of a cross-sectoral experience or vision. So is there something that distinguishes the health sector SMEs from the rest? I think earlier you already mentioned that time maybe is the issue, but is there anything else that we should always be aware of or keep in mind when we are developing our support services specifically to health tech?
So actually, I think it really need to be really practical innovations. That's the main goal. It's really difficult to bring digital tools into these sectors. So you really have to work in a different type of mindset. That's what some other innovation center can work with, actually. So you have to change it really directly to the user, working with the user, understand the need. And that's I think the biggest difference compared to pharma, biotechs, or medtech sectors that actually target a different audience. And you also really work to work with the health sectors, health public sectors, the doctors that can directly be in the cities of the patients, that will understand the best what the patient, if I speak about patient for elderly, can need. So it's really this complex ecosystem that you have to work with. You cannot develop something by yourself. You need the local community, you need the medical health, you need the municipality, you need really small tools. You need also the family to be involved. I mean, it's a really complex system that you have to work with, and that I think can be different for the type of innovation that you can see in medtech, biotech, like I say. Yeah,
that's a really good, good insight. That it's not only about the end user, but also the people around the end user, and then it's a whole ecosystem thing. But the same question, Irene, to you as well. Still, do you see any other specific areas how health tech SMEs and support for them differs or needs to differ from?
Yes, in this case, they have very large processes to arrive to market. And it is very important, I think, the financing to that in this process, because they have a lot of research, they have a lot of testing proofs, they have to change their ways of arriving, and they have important regulatory that they have to pass. So it is important to give them different tools in that sense, like grant assessment, specialized mentoring, and different tools. And it is also very important to give them some contact in order they can do this proof of concept. And it is true that the health sector is specifically in Spain, in which the public health sector is quite big and quite important. And so it is not easy reach and to say, okay, I am here. My product, it is okay. It is good. It is better than what it is now. Please buy me. Because we have our administrative procedures and our laws for purchasing even more complex, the new technology solutions. So that could be a big barrier. That is a big barrier for new technological products and projects in the health sector. I would say that.
And do you work with that as well? Do you help the companies you work with to somehow get their foot into the public sector health system?
Yes, it is very difficult because we are not part of this. We are economic development and for a city, so we don't manage the public health sector. So what we do is trying to be very close to this sector and trying to be connectors and doing sessions, for example, between the hospital and different new innovative initiatives, so that they can know each other. What are they developing? If they sessions for contrast, these new technological products, and so this kind of initiatives.
Thank you.
In that sense, then we have different tools and whatever, but in that sense of trying to be connectors.
And then, as also time is getting to the end of the webinar, I just want to conclude with the final question, whether you have anything else to add. So we've been talking for an hour and a half about health, around innovation. You've presented your good practices. Is there one thing you still want to emphasize as a key message to the listeners, or a key insight for yourself? So whoever wants to go, if there is something still to still to say.
I don't know. For us, it is very important that more and more new technology, or a new, let's say, it is important to continue developing the health ecosystem in terms of taking into account which is the final patient. So try to doing the patient a better life, even if they are young or elderly people. And but it has to be in a sustainable way. So for us, it's always very important, the economic development and the sustainability. And it is very important, these two lines. So continue improving people's life, and but always trying to be sustainable and improving the cities at the end and their socioeconomical situation.
Thank you. And then our colleagues from HIPAA, any last words from you?
Yeah, I would have to say innovation is really important. We are really working with them every day, but never forget the end user in the innovation. Never forget to experiment in every public possible your innovation, and to go and to try to test everything with the end user, with the family, with the doctors and everything, because we see a lot of innovation that are really good ideas, but at the end are not practical and are not used at the end. So for us, it's really important to bring that to life. I mean, I know everyone think about that, but it's sometimes more difficult to do it. So that's why we work on that a lot here, on experimenting in different fields, the solutions that are brought to us. Yeah.
Thank you. Well, with this, we can start also closing the webinar. So first of all, a great big thank you to all the speakers once again for taking your time and sharing your experiences and the practices you're implementing. Also, thank you for the audience for asking the questions. This webinar was also recorded, so it will go on the website, and you will find also an article where we condense the main key lessons or key learnings of the webinar. Once this session closes, then there will also be a feedback survey that will automatically pop up on Zoom. It takes only 2 minutes to fill it in, so we appreciate always to get this feedback so we know how to do the events better in the future. And also, I can say that under the Smarter Europe track, we are planning another webinar in the middle of November around female entrepreneurship. So we will start promoting that in a few weeks' time as well. But already know that if you're interested in the topic of how to encourage female entrepreneurship, then we have another webinar on the middle of November. So thank you everyone for your attention, and have a nice rest of the day. Bye.
Bye.
Thank you to you. Bye-bye.